muscle imbalances? Really, what are they? I think they're underemphasized, and I think it's really important for you to know what they are and what they could be leading to in your body. So think of your body like a structure. Your bones are the structural support, but they're not the only thing holding you up. Without our muscles, we would be a pile of bones on the floor. This is a tent. Think about our body like a structure, kind of like a tent. And the structural support of the tent is not the only thing holding us up. It has guy wires. And our muscles are like the guy wires. They have tension in them. Muscles are tension. They're really nothing more than that. They contract and relax, and they create tension and they release tension. And they rest at a certain level of tension. We call it tone. Muscle tone. It's the resting length of a muscle, and they should be in balance. They'll hold the tent up. But what happens is they get out of balance. So imagine that we took the tent, the guy wires of the tent, and we pulled two of them on one side really tight, and then the other side we loosened them. The tent would be pulled over, and that's kind of what happens in our bodies, is our muscles, the tension in our muscles, our muscle tone gets out of balance, and it affects our posture. It affects the way we move. It affects our joints. Because if our posture is a little bit off, our joints are going to be a little bit off too. Okay? And what happens when our joints get a little bit off? Here's a joint, a ball in socket, like many of the joints in our body. It likes to be congruent. But when it's a little bit off, it leads to friction, increased wear and tear, to degeneration, and it leads to pain, which is our body's way of communicating to us that something's wrong. So we go in and we say, "Hey doc, I got pain in my back." And the doc says, "Well, let's take a picture." And he looks at the picture and he goes, "Yep, you got degenerative disc disease." And right there and there, I feel like I have a disease. Place the stamp on my forehead, and now I can walk around for the rest of my life knowing that I've got a disease in my back. But the reality is that you don't have a disease, you just have friction. One of the most valuable things that I can share with you right now is to listen to your body. You are the only one that can really know what's going on inside your body, because you're the only one that can feel what's going on in your body. You can try to describe your pain to your doctor, but they can't feel what's going on. And on top of that, they're gonna treat the pain, which is one of the major things wrong with our healthcare system, is that it's symptom oriented, treating the symptom instead of the cause. Oh, you have back pain? Here's an injection for your back. Here's a pill to cover up the pain. Here's some surgery to cut out the problem. But what if the problem wasn't in my back? What if it was in my core?